If you take a pill every morning for your blood pressure, and your hair has been thinning, I need you to hear something, and I need you to hear the whole thing rather than the first 30 seconds. Because there is a documented loss, and almost nobody connects the two. Here is why. The shedding does not begin when you start the pill. It begins 2 to 3 months later, long after you have stopped associating the two events, so the thought never crosses your mind. But here is the far more important half of this video, and I want to say it before anything else. Blood pressure medication is protecting your brain and your heart, and stopping it is one of the most dangerous things you could do. What I'm giving you today is not permission to quit. It is the information to walk into your doctor's office and ask a specific, intelligent question, because there are many different blood pressure drugs, and if yours is affecting your hair, there is very often another one that controls your pressure just as well. Stay with me, because the class most strongly associated sits at number 1, and it is one of the most prescribed medications in America for people over 50. I'm Dr. Alan Brooks. I have spent 35 years as a board-certified dermatologist focused on hair and scalp, and more than 10,000 patients have sat across my desk. And I made a video recently about medications and hair loss that a great many of you watched, and the comments were full of the same question over and over. What about my blood pressure pill? Which one am I on? So I decided to do the whole thing properly, one class at a time, because blood pressure medication is the single most common prescription in my patient population, and the connection deserves more than a passing mention. This channel is where I say what I never have time to say in a 15-minute visit. Now, before I go one step further, let me be as clear as I know how to be, and I will repeat this more than once because it matters more than anything else in this video. Do not stop your blood pressure medication. Do not skip doses. Do not adjust anything on your own after watching this. High blood pressure is called the silent killer for a reason, because it does its damage without symptoms until the day it causes a stroke or a heart attack, and the medication you are taking is what stands between you and that. No amount of hair is worth that trade, and I would say the same to my own family. The entire purpose of this video is so that you can go to your doctor and say one sentence. I have noticed my hair thinning since starting this. Is there an alternative that would control my pressure just as well? That is the goal, that conversation, not a decision you make alone in your bathroom. Maybe this is where you are. Your hair started coming out and you searched everywhere for a reason. You blamed your age, your stress, your shampoo, your genes. You bought the supplements and changed the products and nothing helped, because you have been treating something that was never the cause. And the whole time, the answer may have been sitting in the pill organizer on your kitchen counter, in a bottle you never once thought to question, because your doctor prescribed it, and prescriptions are supposed to help you. They are helping you. They are also occasionally doing something nobody warned you about. So let me explain the mechanism, because once you understand it, the 2 to 3 month delay stops being a mystery and becomes the single biggest clue you have. Your hair grows in cycles. At any moment, roughly 90% of your follicles are in an active growing phase, and about 10% are resting, waiting to release their hair so a new one can begin. That balance is what keeps your density steady year after year. Now, certain medications disturb that balance. They interfere with the rapidly dividing cells in the follicle, or they alter blood flow and hormonal signaling in ways your follicles are sensitive to. And your follicles respond in a very specific way. They do not die. A large batch of them abandons the growing phase early and shifts into resting all at once. Here's the crucial part, and the reason nobody makes the connection. That event is completely invisible when it happens. The hair is still sitting on your head. It is simply resting. It takes those follicles roughly 2 to 3 months to complete that resting phase and finally release their hairs. And when they do, they release them together, in a wave. That is when you suddenly find handfuls in the shower and on the pillow. And by then, the prescription that started it is a distant memory from the spring. Doctors call this drug-induced telogen effluvium. Picture a factory where a disruption causes a large batch of workers to quietly walk off the line. Nothing looks wrong at first. The shelves only come up empty months later. And here is the genuinely good news that I want you to hold on to through this entire video. This kind of shedding is almost always temporary and reversible, because those follicles were never destroyed. They were pushed into resting early, and when the trigger is addressed, they very often go straight back to growing. So let us go through the 5 classes, from the one least associated with hair loss to the one most associated. Find yours as we go. But first, let me give you a way to tell whether this is even your problem, because it saves you a wasted appointment. Drug-induced shedding looks quite different from ordinary pattern hair loss, and you can usually tell them apart in the mirror once you know what separates them. Pattern hair loss is gradual, and it has a shape. It creeps in over years, and it targets specific zones. The temples receding into an M, the crown thinning into a circle, the part slowly widening, while the hair at the back and sides stays perfectly dense. Drug-induced shedding is the opposite on both counts. It is diffuse, meaning it comes from everywhere at once, including the back and sides, so your whole head thins evenly rather than in a pattern. And it is comparatively sudden, arriving over a few weeks rather than a few years. Often dramatically enough that you notice it in the shower drain before you notice it in the mirror. So ask yourself 2 questions. Is my hair thinning everywhere or in a shape? And did this arrive over weeks, or has it been creeping along for a decade? If the answer is everywhere and weeks, keep watching closely, because this video is very likely describing you. If it is in a shape and over years, your medication is probably not the main story, though it can certainly be making an existing pattern worse. Number 5 is the class called ARBs, angiotensin receptor blockers, and you will recognize these because their names almost all end in sartan: losartan, valsartan, irbesartan, olmesartan. These sit at the bottom of my list because they are the least commonly associated with hair loss of the classes we will discuss. Reports exist, and I will never tell you something is impossible, but they are relatively uncommon compared to what is coming. So if you are on a sartan and your hair is thinning, the honest thing for me to say is that your medication is probably not the main culprit, and you should look elsewhere, at your iron, your vitamin D, your thyroid, your stress, or simply at hormonal pattern hair loss. That is genuinely useful information, because it stops you from chasing the wrong cause for a year. And there is a second reason this matters, which will become important later. If you are on a class higher up this list, and it is affecting your hair, the sartans are often exactly the sort of alternative your doctor might consider. Number 4 is the calcium channel blockers, and amlodipine is by far the most common one you will be taking, along with nifedipine and diltiazem. These are only occasionally associated with hair loss, and interestingly, the reports run in both directions, because these drugs work by dilating blood vessels, and a small number of people experience unwanted hair growth rather than loss. So this class is genuinely mixed. What I would say if you are on amlodipine is that the timing test matters more than the statistics. If your shedding began 2 to 3 months after you started it, or after a dose increase, then despite it being less commonly reported, it is worth mentioning to your doctor. Individual responses vary enormously, and a class being uncommonly associated does not mean it cannot happen to you specifically. The mistake here is dismissing your own timeline, because a list on the internet said it was unlikely. Now, before we get to the top 3, do something for me. Go and look at your actual pill bottle right now and type the name of your blood pressure medication in the comments. Just the name. And tell me your age and whether your hair started thinning within a few months of beginning it. I think a great many of you are about to count backwards on a calendar and have a small moment of realization, and I want you to see how many others are having exactly the same one. Number 3 is the ACE inhibitors, and these are the ones ending in pril. Lisinopril, Enalapril, Ramipril, Perindopril. Hair loss has been reported with this class, and it follows the same delayed shedding pattern we discussed. Now, if you are on an ACE inhibitor, there is something else worth knowing that is not about your hair at all but that I mention because it is genuinely useful. The most common side effect of this class by a wide margin is a persistent dry cough, and it is one of the most frequent reasons doctors switch people to a different drug. So if you have both a nagging cough and increased shedding, you have 2 reasons to have that conversation rather than 1. And doctors are very used to switching people off this class for exactly that reason. The mistake I see is patients enduring both the cough and the hair loss for years, assuming this is simply the price of controlling their pressure, when a switch is routine and unremarkable to the doctor who prescribes it. Number 2 is the diuretics, the water pills, and this one contains a genuine surprise that I think will change how some of you think about this entire subject. The common thiazide diuretics, like hydrochlorothiazide, have been associated with hair loss, and there is a second-order effect worth knowing, because diuretics can deplete certain minerals over time, including zinc, and low zinc has its own well-documented connection to hair thinning. So there are potentially 2 routes at once here. But now the surprise, there is one diuretic, spironolactone, that is actually used deliberately by dermatologists as a treatment for hair loss in women. It has anti-androgen properties, meaning it works against the hormonal pathway that shrinks follicles, and it is a genuinely established tool in female pattern hair loss. So within the same broad category, you have drugs that can cause thinning, and one that is prescribed to treat it. I tell you this for a specific reason. It demonstrates better than anything else in this video that the answer is never simply blood pressure medication causes hair loss. The answer is that the particular drug matters enormously, and that is exactly why this is a conversation with your doctor rather than a verdict from a video. And now number 1, the class most strongly associated with hair loss, and one of the most prescribed medications in the country. For people over 50, the beta blockers. You will recognize these by their names ending in olol. Metoprolol, atenolol, propranolol, bisoprolol, carvedilol. Of all the blood pressure classes, this is the one with the most consistent and best documented association with hair loss, appearing reliably in the literature on drug-induced telogen effluvium. It follows the same pattern: diffuse thinning across the whole scalp, rather than a receding hairline or a bald patch, beginning 2 to 3 months after starting, or after a dose change. Now let me be careful and fair here, because beta blockers are prescribed for far more than blood pressure. They are used after heart attacks, for heart rhythm problems, for heart failure, for angina. And in those contexts, they are frequently life-saving in a very literal sense. So please do not read this section as a reason to stop one. Let me tell you about Robert, 62, a patient of mine who came in absolutely certain his thinning was genetic, because his father had gone the same way, and he simply wanted to know if anything could be done. But the pattern did not fit, because it was diffuse across his whole head rather than following the classic male pattern, and it had come on rather suddenly rather than creeping in over a decade. So I asked my question: what did you start and when? He had been put on Metoprolol after a cardiac scare, and when we counted back, it was about 3 months before the shedding began. He had never connected them, and here is what he did exactly right, and what I want you to do. He did not touch his medication. He went back to his cardiologist, explained the timing, and they reviewed it together. In his case, given his cardiac history, the beta blocker stayed because it was protecting his heart, and that was not negotiable. But knowing the cause changed everything anyway. Because he stopped spending money chasing the wrong problem, he understood that this type of shedding often stabilizes over time even while the medication continues. And he stopped lying awake wondering if he was going bald forever. Sometimes the answer is a switch. Sometimes the answer is that the drug stays and you support your hair around it. Both of those are far better than not knowing. So here is exactly what to do, step by step. First, get the facts in front of you. Write down every blood pressure medication you take, the dose, and the date you started it or last changed it. Second, take a calendar and count backwards from when your shedding began, looking for anything that started or changed 2 to 4 months earlier, because that gap is the fingerprint of this entire process. Third, and this is the whole point of the video, take that to your doctor and say this sentence: I have noticed increased hair shedding since starting this medication, and I understand I should not stop it. Is there an alternative class that would control my pressure just as well? Those words open a door that stays firmly shut if you never mention it. And as you have just seen, there are at least 5 distinct classes with quite different profiles. Fourth, ask whether your levels are worth checking, particularly iron and zinc if you are on a diuretic. And fifth, while you sort that out, support your hair with the basics: gentle washing, adequate protein, and no harsh treatments, so you protect what you have. And on that last point, one brief practical note for this audience specifically. If you are on medication for your blood pressure, anything you take by mouth for your hair, supplements included, carries a real question of interaction, and that is a genuine concern rather than a technicality. Topical treatments do not carry that problem in the same way, because they are not circulating through your system or competing with your prescriptions. If you want the botanical route while you work with your doctor on the medication side, the ritual I recommend to patients is a topical one, linked in the description. But please, run anything you take internally past the doctor managing your blood pressure first. That is not caution for its own sake. That is how you avoid creating a second problem while solving the first. One thing, doctor to viewer, and I will say it a final time, because it is the most important sentence here. Nothing in this video is a reason to stop, skip, or adjust your blood pressure medication. Uncontrolled hypertension causes strokes, heart attacks, kidney damage, and worse, and it does it silently. Every change belongs to the doctor who knows your full history. Also understand that hair loss has many causes, and your medication may have nothing to do with yours. And if your hair is coming out suddenly, in distinct patches, or alongside other symptoms, see a doctor promptly, because that deserves proper attention on its own. I am a doctor, but I am not your doctor. Now, one last honest word, because this is where the real hope in this video lives. If your shedding is being driven by a medication, then you are not watching an irreversible genetic process unfold in the mirror. You are looking at living follicles that were pushed into resting early, and that very often go back to growing once the trigger is addressed or once your body adapts. Expect the shedding to settle over a couple of months after a change, and the density to return gradually over 6 months to a year, because those follicles have to finish resting and grow out again. But the deeper point is this. For decades, patients were handed a prescription and a 90-second explanation, and side effects that were not life-threatening simply never came up. Your hair matters to you, and that makes it worth mentioning. A good doctor would far rather adjust your treatment than have you quietly stop taking it, which is what people do when nobody listens. So go and look at that bottle, count backwards on the calendar, and take it to your appointment. And come back and tell me in the comments what you find. Type your age too. I read every single one. Take care of yourself. I will see you in the next one.